All right, if you're someone who manages a group health plan, you're going to want to listen up. There is a really big change coming down the pike, one that's going to affect both your compliance and your members' health. So today we're going to break down the new preventative care rules that are taking effect in 2026, and most importantly, what you need to be doing now to get ready.
So, what's the magic number? 2026. That's the year you need to have circled on your calendar. And I know it might sound like it's a ways off, but trust me, it's going to be here before you know it. The changes that are required are pretty substantial. This is the year your health plan's preventative care coverage absolutely must be updated.
Which leads us to the big question, doesn't it? Is your plan actually ready for this? It seems like a simple question, but the answer, well, it's got a few moving parts. Our goal in this explainer is to give you everything you need so you can confidently say, yep, we're ready.
Okay, let's get into the nitty-gritty. What are these new rules really all about? We're going to break down the specifics of what's changing and what your plan will need to do.
Here's the bottom line. For any plan year that kicks off after December 30th, 2025, your plan has to expand what's known as first dollar coverage for women's preventive care. So what does that really mean? It means more services will be covered at 100% with zero out-of-pocket costs for your members. No copay, no deductible. It's a big deal.
So, what does this expansion actually look like in practice? It really comes down to two main things. First, there's a really significant expansion in what counts as a covered breast cancer screening. And second, we've got the introduction of a brand new covered benefit called patient navigation services. This right here really shows you the impact. Under the old rule, basically, the initial mammogram was covered without cost sharing. Great. But now, under the new rule, it's the initial mammogram plus any follow-up imaging. We're talking MRIs, ultrasounds, or even pathology that's needed to complete the whole screening process. This is a total game changer for patients because it removes those huge financial barriers that could pop up after that first test. And then there's this second part, which is totally new: patient navigation services. You can think of this as a personal guide for members trying to get through the healthcare system, which, can be incredibly confusing. It's individualized help from helping schedule appointments to arranging for a translator or even transportation. It's a really powerful way to knock down those real-world barriers that can stop people from getting the care they need.
So we know what's changing, but it's just as important to understand why it's changing. The why really gives us the context we need to make sure we're getting compliance right. This didn't just appear out of nowhere. It all goes back to the Affordable Care Act, which requires plans to cover recommended preventive services. So a federal agency called HRSA is in charge of keeping those recommendations current. At the end of 2024, they issued these new, updated guidelines, and the law is pretty clear. It gives plans 1 full year to adopt them, which is exactly what puts us right at the 2026 plan year. Now, we've used this term first dollar coverage a few times, so let's just make sure we're crystal clear on it. It's a simple idea. The plan pays 100% of the cost. The member pays nothing. No deductible has to be met. There's no copay, no coinsurance. The entire point is to remove financial hurdles to getting critical care.
All right, so we've covered the what and the why. Now we get to the most practical part of all this. What do you actually need to do to get ready? Let's walk through your action plan for 2026.
Here's a simple 4-step plan. First, you need to review your current plan's coverage. Second, you've got to determine what changes you need to make to meet these new rules. Third, and this is key, you have to communicate all of these updates clearly to your participants. And finally, number 4, you need to update your official plan documents so everything is in writing.
And that third step, communication, is absolutely crucial. You can't just make the change behind the scenes. You have to formally let your members know. This is usually done with a document called a Summary of Material Modifications, or an SMM, or by sending out a whole new updated Summary Plan Description, which is the SPD.
So as we wrap this up, we come right back to that central question. With these new, much more comprehensive coverage requirements on the horizon, it's really time to take a hard look at your current plan and start putting that prep work in now. This quote from the guidelines really says it all. It's about covering everything required to complete the initial mammography screening process. That's the new standard, and that's exactly what your plan needs to be ready for.
Look, the 2026 deadline is closer than it feels. The question isn't if you'll comply, you have to. The question is how you're going to get there. So are you ready to take the steps you need to protect your plan and, most importantly, protect your members?